Clerk will read the next bill.
House Bill 3091, relating to behavioral health treatment.
Question now arises upon third reading and final passage of House Bill 3091A. Representative Keny-Guyer.
Thank you, Madam Speaker, and I will be a little shorter on this now that I've given the background, but I forgot to say on the last one, and I'll say it on this one too. Both these bills did pass unanimously out of our committee, as did the ones a couple years ago. House Bill 3091 is equally, if not more important. While the last bill asks hospitals to develop and implement release policies that lead to a better continuity of care once a patient is released, this bill, House Bill 3091A, requires public and private payers to reimburse for services determined to be medically necessary to transition an individual experiencing a behavioral health crisis to a lower level of care. Our work group of stakeholders, joined by DCBS, spent a lot of effort trying to identify policies that would bring more parity to the mental health field, while not asking payers to go beyond what is expected in the physical health arena. As soon as we go beyond that, then the state could be on the hook. So we worked really hard to identify in the physical health arena, if something is medically necessary, you do an assessment for what's medically necessary, and then you provide treatment for what's medically necessary. How do we define that in the mental health arena? So having more clarity about what constitutes parity in certain settings, and thus clarifying expectations about reimbursement, both from the CCOs as well as private payers, should help build the workforce of a much-needed mental health providers. Thank you, colleagues.
Thank you, Representative. Further discussion? Seeing none.